The proposed legislation would require the use of seatbelts by youth ages 11 through 17 when riding in the back seat of a vehicle. The current law covers the youth in the front seat and children in the back seat only through age 10. Teenagers have the highest crash risk than any group in the United States. This can be attributed to a couple of things: their lack of driving experience and their propensity to take risks. Also, teens oftentimes ride with other teens. Because of these factors, the age group faces substantially elevated risk for injury and death from traffic crashes. Teenagers' failure to wear seatbelts compounds their already high crash risk. Studies have routinely shown that seatbelt use among teenagers is lower than among older age groups and substantially lower among teenage passengers than among teenage drivers. Data will support this legislation. From 2004 to 2007, a total of 1,823 injuries were reported for unbelted youth between the ages of 0 and 17. 84% of the injuries reported were in the 11 to 17 group, currently not covered by the seatbelt law if riding in the back seat. Fatality data also substantiates passage of this bill. Parallel to the injury data for the same time frame of ages. Of the 71 reported unbelted fatalities, 15 occurred in the 0 to 10 group, those covered by the current restraint law, but 85% covered in the 11 to 17, those not covered while riding in the back seat. Finally, the costs are not only in terms of health and safety and the very lives of young people, there is a dollar cost as well. Hospital costs for the unbelted teens comprised 77% of the total hospital charges compared to only 23% for those who were buckled up. Despite widespread knowledge about the risk involved, teens do not routinely wear seatbelts when riding in the back seat. Of Iowa high school students ages 14 to 17 surveyed regarding their current seatbelt practices, 83% indicated they always or usually wear their seatbelt while driving, but only 30% said they usually or always wear their seatbelt when they are a passenger in the back seat. In October 2009, parents of these 16 to 17-year-olds were asked, do you think passengers riding with a newly licensed teen driver should be required to wear a safety belt? 99% overwhelmingly said yes. Backseat passengers pose not only a risk to themselves, but passengers in the car as well, and drivers whose risk of death is 2.27 times higher when there is an unbelted rider sitting behind him or her. These we call sometimes backseat bullets or flying projectiles. Seatbelts are effective in reducing fatalities. A 2007 study looked at 10,736 crashes with backseat passenger estimates that rear seat occupants who wear seatbelts, compared with those who do not, can reduce their risk of death by approximately 60% in a car and 70% in a light truck. Iowa's public safety standards should create a consistent safety culture. 44 states now cover youth passengers under the age of 16 with a seatbelt requirement. This legislation provides consistency and proper guidance for parents. It is inconsistent to say that we believe it is important for children through the age of 10 to be appropriately restrained, but not once they turn 11. Many parents reported that they have very little or no control over their teens wearing a seatbelt in the back seat once they get into the car. But they'll be much more likely to wear them if it's the law. It is a learned behavior. Several Iowans have testified about not having seatbelts and what that means. They spoke eloquently and passionately and persuasively, and they shared their stories of their own personal losses. A pediatric emergency physician said, "When I have asked some of the kids why they weren't wearing their seatbelt, they all gave me the same answer: because it's not required by the law." Because it was not required, they presumed it's not important. By passing a youth seatbelt law, we will give our kids the message that it is important to wear a seatbelt and they can save lives. I had a lot of help on this bill, and I want to thank my friends at Blank Children's Hospital, Kathy Leggett and Jana Hyatt, particularly Linda Plummer and Kylie Davidson, for their hard work on this legislation. It's also had the fingerprints and the hard work of the Hospital Association, the Department of Transportation, the Department of Public Safety, the insurance lobby, and I want to recommend, I want to identify another person and to thank Isaiah Kroll and his mom Renee, who are up in the gallery. Isaiah was involved in a car accident, car crash. He was only driving 1.5 miles on a country road and thought he wouldn't need his seatbelt. He is here today after sustaining injuries 2 years ago. He is here today in support of this. This concludes my opening remarks. I think we have some other speakers on this subject, Mr. President.